growing weary of running from room to room, practicing one-tooth insurance-driven dentistry? Then stay tuned for the latest episode of The Lionhearted, where Dr. Stephen Rasner will hand you the blueprint for what many call the gold standard of general practice dentistry.
Hi everyone, Dr. Steve Rasner here with the Lionhearted Dentist Podcast. Thanks to all my friends around the globe that keep on downloading these episodes, particularly the countries of Germany and Ireland, who either there's two of you connected there that are sharing some of these, but whatever it is, it inspires me when I see significant downloads from a certain country. So, thanks for listening. I'm going to try a little different format, very little subtle difference going forward for the next few weeks, in that when I look back at who is downloading these on what subjects, it seems that a lot of you, more than I would think, download my clinical-based podcast, which I've done a few of in the last few months, the most. And I say I'm surprised because it's kind of hard to translate clinical information in the form of this podcast. I'm not showing you 3D model work, which I could do, by the way, and things like that. But either I'm reading the numbers wrong or that's really true. So I thought I'd just give one brief clinical tip at the beginning of each podcast. And here it is for this week. Because before I get to the subject matter, I will tell you ahead of time my blood pressure is going to spike because it's a subject that incites me. And I'll get to that in a minute. But here's the clinical tip. If you find yourselves involved with an extraction next week, okay, you're taking a tooth out, even if you don't listen to me in using elevators as opposed to forceps, as I have stressed before, I'm not talking about a periodontally involved tooth. I'm talking about a tooth you're taking out for whatever reason. Even if you don't normally take teeth out, I want you to try this. After you sever the fibers with a Molt 2.4 elevator or whatever you're using, and when I say that, I mean you're just going around the tooth 360, pushing against the buccal tissue so you don't rip the tissue, which all of us have done when you remove the tooth. So do that always first. But even if you're going to use a forceps, take the forceps and torque the tooth away from the buccal and hold it there for 10 seconds. Okay? Now, you might be thinking that you do that. I would suggest you don't really do that. You hold it for a couple seconds and then you jerk the instrument continually with intermittent pressure. No, I want you to hold it and count to yourself 10 seconds. It's going to be brutal. It's going to seem in your mind like this is not worth it. And watch how, and then go in the opposite direction. No torque toward the buccal so you don't bust the buccal plate. And just tell me if that little tip doesn't make because you're really going to be using the forceps in that manner, like I use an elevator. And on occasion, I do that as well. So, tip for the week, and it won't always be, by the way, on surgical procedures, but just that one. I can tell you from the courses I've been giving, especially lately, even when I say this, even when I teach it in person, when I go into the clinic and watch the doctors begin procedures, when they get to that stage, they're not holding. And you're utilizing a concept, a biomechanical concept of the anatomy of the mouth and the bone and the periodontal ligaments called creep. And you're making something that can be challenging rather easy by interfering with the biomechanics on purpose by holding and torquing for 10 seconds. Okay, that's it. All right, back to my blood pressure. So, believe it or not, on occasion I do research before I do these podcasts. And I did. I went on Google and I looked at some sources that I'm familiar with regards to the economic health of our dental industry. And remember, we're past the first quarter of 2021 already. 3 months is gone. And I have to ask you to ask yourself, where are you with your progress for change? Again, obviously this appeals to those of you in a private practice situation right now. But even if you're in an associate position with the dream and the intention of having your own practice, or even if you're a D dental student and you're thinking of your next 5 years, it's particularly germane to you, because when you get out, I am going to ask you the following. I need you to stop doing or thinking what you're doing right now. If you care at all about your future, turn off your phone, turn off your television, radio, music. Be in your own thoughts for a minute and ask yourself the following. How long are you going to be willing to participate in the incredibly deceptive practice of accepting dental insurance? Don't you turn me off, please. I don't get it. And I know I've spoken on it endlessly. And here's why. This is what I found online. I want you to stay with me. These quotes I'm giving you, these statistics, they're not some fly-by-night speaker, and I have several sources here, not just one. They're from people that you know about. So one mentor was commenting that the collection percentage for all GPs was a disappointing 91%. Just, I think it was 2 years ago. So he gave an example. So for every 100,000 in production, that practice is losing $9,000. And the focus of his article was how important it is for you to collect balances that have been generated in your practice. And he's absolutely right about that. There's a statistic that if you don't get the balance within 90 days, 80% of you will never collect it. 80% will not collect those balances over 90 days. There is another, this is just one page that I looked at. Another quote from Dental Products Reports. You've all heard that. In 2015, the average monthly revenue in dental practice was $121, but the actual collections was 102 out of the 121, reinforcing this other speaker's point of view. That's another source that said you're not collecting enough, and that's quite a significant gap, for sure. And in yet another source that I found, they talk and are correct that the general accepted percentage of collections is a minimum of 98%. And in one of their tables that they show in this particular article, one of the lines in that table to do your math on your practice is adjusted production. So let me, in case I'm not being clear enough, all three of these sources, and I could spend hours of multiple podcasts with this information, types of information, are all talking about how important it is for you to collect your balances. I agree. None of them. Not a one. Now, so keep in mind, they're talking about 98, so you should not have less than 2% that you can't collect, right? That's the minimum standard, 98%. Pretty impressive. Things happen. Things fall through the cracks. And we don't collect sometimes at 100%. I have a remedy for that, by the way. I do collect 100%. almost every year. Sometimes it's been greater than 100%. And that's because I get paid up front. But that's not the essence of this particular podcast. The essence is no one, not any of these articles, allude to or talk about the 30% plus that you all write off with insurance. As if even the leaders of your industry, you can exclude me on that, acknowledge as if it's okay, it's part of the industry, that you have to accept dental insurance and write off 30%. 30%! They're making a big deal about, well, one article, you didn't collect 9%. And they aspired for you to collect 98%. I get it. What about the adjusted production? You know what that means, right? Do you know what that really means? It means that the industry and the industry leaders have accepted the fact, hundreds of years into our profession, that it's just the way it is, that you produce a certain fee, a certain service, but you're not getting paid on that. You're going to immediately write off approximately 30%, and I think I'm being very fair with that number. I know that sometimes it's less, and often it is way more. Well, let me ask you a question. Are you gouging your patients with your fees? When you came up with your fee schedule, when you opened that practice that you're in right now, and you decided what your crown fee was going to be, what your scaling root planing fee was going to be, whatever, did you feel at the time that you looked at your fees that, well, I'm going to really get these consumers and I'm going to charge them more than I'm worth, with the hope that if I lose, I don't get 20% of it, I'm really okay? Did any one of you ever do that? And by the way, my colleagues in Europe or Canada, you're in similar situations. You are. I mean, some of you don't have dental insurance set up the way we do, but you have a recommended fee structure that the majority of you follow because you don't want to be out of line. I mean, you shouldn't charge your worth because you're just like everyone else, right? Because we're all the same. I'm sorry, it does make me angry. It's beyond belief makes me angry because you can't even find literature on significant guidelines and literature in the resources on on a fee for service practice. A fee for service practice. What is that? It is what every other business in the world is set up for. I'm sorry, I know you've heard these analogies before, but when you go to get a car, that's like a little bit like dental insurance because I think everybody knows that you can negotiate to some degree that fee. I don't think it's true when you go and buy food products for your home. And of course, there's a host of other. Do you bargain with the electric company and the telephone company and your wireless services? Do you barter with them every month? Call them up and say, hey, I saw my bill of $380 for last month for my internet services, and I really think we both know that should be 30% less. That is exactly what you do every day. Why are you accepting that? It's just boggling my mind. And even I have said on these podcasts that in the beginning of your career, I get it. I don't know, because I always speak the truth here, and I didn't do that. I did what most of you doing. I participated in a multitude of insurances, and let's not kid each other. We know what happens. There's a given day of the week that you get a big fat check every week that constitutes the insurance companies pay you. And maybe it's Monday or Wednesdays, or I don't know what it is. And you feel great about that on that day because that's kind of always going to be a good day. It's different for all of us when that insurance money comes in. But do you ever, and I would suspect the answer is no, Do you ever sit down and say, well, you're looking at a big fat check of whatever thousands of dollars it is for a multitude of services you provided. Do you ever look back at it? Do you ever have the time, because you don't, to look at those checks and say, well, what did I really get paid for in this bigger sum of money? You know, if you knew that, it might inspire you to take action to fix this. Listen, this is called the Lionhearted Podcast for a reason. I'm sorry, it's not called the Chump Podcast. You can do whatever you want to us. It's not called the Punk Podcast. I want those of you that listen to me to be fighters, to be warriors in your pursuit of the profession that we both chose. That's why I'm talking about it. I know it's not unique to me. I'm a fighter. I always have been. With my principles. And I know many of you are, because I can tell with your correspondences to me. I can tell. You went out and you got your sedation permit. You see, unless you do have something special to offer, it might be a road less traveled on dangerous ground for you to just, because I'm saying it. You do have to some degree, distinguish your practice from the other practices so that patients will come to you out of network, which, do you understand? That isn't exactly what they do with me. They go out of network. If the incredible majority of the population of the public of our communities throughout the world participate in some level of insurance from their employers, that would mean that those of us that stick to our principles and don't accept insurance fees, that we are on the road less traveled. So it makes intuitive sense, as it should to you, that from the moment they call you, what do you have in place that separates you from the place they were going to? And the Lionhearted Blueprint that I've been giving you for 2 years. It's right there in front of you. Everything that matters is right there in front of you. For me, inspiring you to uptick your clinical skills. Does anybody listening really think that every crown done tomorrow in the United States or Canada or wherever is equal quality? You shouldn't think that, because it's not true. Or the recommendations that a patient receives, or direct restorations, I find it laughable that I have to even convince anybody that we're not all the same. But that's not enough even. I've said that in every podcast. You could be the greatest clinician listening on this podcast this week. And maybe your service, maybe your attitude in your office is a negative thing to patients. Maybe you have what I call a vulture at your front desk. Somebody you inherited from a past practice that you purchased. I had one. I've had them in my career. And you don't even know what they're saying to your patients. You find out usually accidentally. So that's a big part of this. Do you have this, I don't know, when I don't want to confuse you when I say Ritz-Carlton quality front desk team. It doesn't have to be glitzy, but it does have to be people that know how to make people feel value. I've talked about your venue. Is it spotlessly clean all the time? You know, all the time. So, yeah, there's a number of parameters. And the first step I asked you, I said, we're 1 quarter past this year. You still can change and make this year the year it all started. I remember I spoke on past podcasts about putting the drills down and dedicating time with the key team members, which might be all of them, to how you're going to implement change from last year. And if you're taking insurances, it's the number one change you need to make, but you can't turn on a switch if you have not separated yourself. Am I making myself clear? It's so clear to me. Do you know how much more profitable it is. I mean, I want you to hear this, and then I'm going to let you go. Do you know how much easier work is? How much more profitable your organization is? How that more profit enables you to do benevolent things in your community or for other folks and patients that come to you that nobody even knows that you did this stuff for them. Because your profit structure allows you to do that. Because you're not starting out each day writing off 30%. I don't think you have a clue, those of you that haven't had that. Those of you that accepted insurance for 10 and 20 and 30 years because it's easy not to change, it's scary to change. You may have a big conglomerate in your community of, let's say, Delta dental patients. That's a big one in the United States. And you're scared that they'll leave you, and some of them absolutely will, if you break from Delta. Do you know how liberating, how accomplishing it feels to dictate in your own terms? I didn't come in here on this podcast and say, raise your fees by 20%, and that's what you deserve. I simply said, keep your fees the way they are. Just get paid what you're supposed to get paid by not participating in insurance. I wouldn't say this had they not made the toxic and detrimental implementations they made in the last 8 to 9 years, more than that, 10 years ago, when insurance companies really stepped up their reduction of whatever services we apply for, not increasing their maximums per year. I mean, you all know this information, but you allow it. That's not the Lionhearted way. That's a different podcast. That podcast talks about upping your volume, decreasing your hygiene hour appointments to 30 minutes and getting a hygiene assistant to help the hygienist so they can see more patients. Can you see the conflict? Can you? Of how a practice like mine that gives an hour, in some cases, whatever the hygienist thinks she needs from past visits. Sometimes it's an hour and 15 minutes. For a recall visit versus 30 minutes, where do you think the relationship-based clinician-patient dynamic gets enhanced over the 30-minute in and out or in the one I just discussed? Just as one example. This is achievable. It is scary, and I get it. And I will help you, as many as I can, get there. Because the first step, and we've had this conversation, is for you to figure out what you are taking right now. Because as toxic as they all are, insurance companies, they're not equally toxic. And you have to eliminate the worst ones first. Most of you have made a conscious decision in your career not to accept Medicaid because that's so low, it's an easy decision for you, right? Well, this is the same one, moving up a couple notches to private, non-Medicaid, non-government insurance plans that are also toxic, just not as obvious to you. You could be out of this whole thing and make all the changes you need to in a matter of 2 years. So I would gladly guide you, help you. But you got to want it. And it shouldn't, but it infuriates me that you allow yourself, those of you that do, to be so manipulated. Just take 30% of your rate. It's almost an insult, as if you don't have a say. Can you hear how disconcerting this concept is to me? Anyway, I've had this topic with you before, and I don't remember what inspired it this particular week, but maybe this will change one of you listening to begin the road that is real. Remember, I'm in that road. Fee for service, surrounded in a part of the United States where literally I am the only fee-for-service practice. And I'm not saying that with pride. I'm saying it with disappointment. And it is doable. And you need to write to me if you need help. I hope this will light a fire under some of you out there. And let's talk next week on the Lionhearted Dentist.